Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Hello, Haley. I'm doing great.
Good. Well, I wanted to continue our series on fatigue, and something I've seen in the practice pretty frequently is the diagnosis of chronic fatigue. And I was curious, at what point does it become chronic? And that kind of seems like a blanket statement, and I'm wondering what that actually means.
So there's fatigue, and then there's chronic fatigue, and do we need to add the word chronic to it? I mean, if you have fatigue for a long time or chronic fatigue, isn't that the same thing?
Mm-hmm.
The answer is, if it was common sense, yes, except for this is not a common sense kind of thing. The reason why chronic fatigue got the name chronic fatigue is because doctors couldn't figure out why their patients were fatigued.
Mm-hmm.
And so they ran all the normal tests, the things we've talked about already. They ran thyroid tests, and they ran a test for anemia, and they ran tests for adrenal dysfunction, whatever, right? Infections, whatever they could find. They just would run all the tests they could find, and they couldn't find anything wrong. And so they had to come up with a name for it so that they could talk about it, and so they could code for it. And the name they came up with was chronic fatigue syndrome. And what chronic fatigue syndrome is, it's known as a garbage can diagnosis. That is, after you've checked for everything you possibly could put this fatigue into in terms of its category, and it doesn't fit in any of those categories, you wad it up and you pitch it in the garbage can.
The garbage can of chronic fatigue.
2 points. We're going to call it chronic fatigue syndrome.
Okay.
And that's where it comes from.
So are there different symptoms that chronic fatigue might have that regular fatigue doesn't have?
Yeah, not so much.
Yeah.
Though there is a certain collection of symptoms that are characteristic of chronic fatigue syndrome.
Okay.
Before I tell you what those symptoms are, let me just get to the punchline on this whole thing and say, we figured out what chronic fatigue is coming from. Now, back when this was coined back in the late 80s, no one knew.
Mm-hmm.
But now, we know. So let me just tell you what it is, and then you'll be able to figure out what the symptoms are already. Chronic fatigue syndrome is what happens when you get a subtle infection and then it lingers.
Okay.
Okay? The key word is subtle. That's so subtle you can't find it. And typically it's a viral infection that has been cleared from the body already, except for
There are remnants.
once
still?
you ring the bell, bing, it continues to ring, 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 ring for months to years afterwards, or longer even, and you never get better. Now you don't have the infection, they run the test, there's none of that in you anymore, and yet you still have the symptoms from it.
Huh.
So if you think about what would happen if you had a viral infection.
So if you had like a flu,
Yes, like a flu.
You would have body aches,
Uh-huh.
you would feel sore,
Uh-huh.
you would feel tired.
Uh-huh. Headache?
Headache, yeah.
Maybe.
Nauseous, maybe?
Maybe, depending on
Dizzy.
who you are. Dizzy could be one that you were feeling. And the classic one is, if you do anything physical, it wastes you out.
Yeah.
As long as you're sitting quietly, watching TV, reading a book, doing nothing, I don't know, I'm okay, I feel pretty good. You get up to go do something, I feel horrible. That's what I get when I get the flu.
Right, yeah.
Sometimes I'm so miserable that even laying down I'm miserable, but a lot of times I'm okay laying down.
Yeah.
I can get into a movie and almost feel normal for a second until I
If you
get
don't
up.
move.
If I don't move.
Yeah.
And heaven forbid, if I was to exercise, I would absolutely be wasted. Now, this is a very important point, because in the real world, when people are tired, you say, you should just get up and do some exercise. It'll make you feel better. It does me. I feel better when I exercise. And so you do exercise and you feel absolutely worse. You feel wasted. And the doctor has no idea what you have. They have no idea. They're thinking of themselves in their life, and they're not thinking of you in your life. And so they really don't know what you have. And it's frustrating for everybody.
Right.
Now I've just took that frustration away. So if it's doctors listening to this program, or patients listening to this program, or spouses listening to this program, just imagine how you felt when you had the flu. That's chronic fatigue. Now you know.
Okay, so this is kind of making me think of different viruses that we've experienced. One being COVID and the ramifications of COVID, and some patients experienced long COVID.
Yeah.
Would that be a
Chronic
form
fatigue?
of chronic fatigue?
By definition, it's not, because remember, chronic fatigue is a garbage can diagnosis that if you rule everything out, then all you're left with is this thing we're going to call chronic fatigue. And if it's being caused by COVID and it's long COVID, then it's not by definition chronic fatigue, except for it is exactly chronic fatigue. It is another manifestation of the same process that leads to chronic fatigue, and it is in fact chronic fatigue. So long COVID is our modern chronic fatigue.
Wow, okay.
So you basically you pick a virus that lingers in the body and that affects the immune system, and you just kind of like, again, you ring the bell and it doesn't unring. So COVID is one. Epstein-Barr, that's the one that does mono. That's classic. In fact, Epstein-Barr is so classic for chronic fatigue. For a while, it was thought that chronic fatigue was caused by Epstein-Barr viral infections. And it made sense because almost everybody you look at with chronic fatigue had antibodies to Epstein-Barr infections, except for when they didn't. And occasionally somebody would come along and they'd have classic chronic fatigue, the same symptoms, the same pattern, the same everything, except for they didn't have any Epstein-Barr. And so doctors were disappointed. Well, I guess that's not it. And it turns out that it isn't always it. There's a bunch of other stuff that it could be. I'll give you some other examples. And this is not an exhaustive list. You could have a weird kind of herpes simplex 6. I mean, we all know about 1 and 2. Those are the ones that give you the sores and genital thing and all that stuff. And this is 6.
What is the 6? Is the 6?
It's just another kind of virus. It's in the herpes family.
It's in the herpes family. Sores?
And you don't get sores. No, you get no sores. What you get is a mild flu that you may not even remember, where you just feel kind of achy one day, and then it just never gets better. And it just lingers and lingers and lingers and lingers and lingers. It's called a stealth virus because it hides so well.
Right.
And when I was in medical school, I never even learned about it. I didn't even know it was a thing. It wasn't until I started working chronic fatigue cases, and we've done a lot of work on this, a lot of experience over the years of treating a lot of patients, and in the process of doing research, looking into it, trying to find out more about it, I came across this herpes simplex 6. So now I routinely check for it. We do, because I ordered the test and you put it in.
And I enter the test, and I draw the blood, and I make sure it gets to the lab.
Yeah, so sometimes you pretend like you don't know everything you know, and I know you know, and you know, so now they know that you know, right?
I know, it's out.
So anyways, we do that, and we also do cytomegalovirus, and we do some other bacterias, Lyme, or it's a bacteria, it's a spirochete, and we do mycoplasma pneumonia, sometimes that'll show up. So it's not always viruses, sometimes it could be bacteria or a weird kind of bacteria.
Is there like a period of time or a length of duration that somebody's been experiencing these symptoms that leads you into the direction of a viral infection more so than just regular fatigue?
Yes and no. If it's been lingering for a long time, it tends to be a viral infection or the remnants of a viral infection. A lot of times people still have the virus in their body. It's in such low levels, it's hard to pick it up. PCR testing has been helping us pick these cases up. But I find the actually thing that's most helpful is to run certain kinds of antibodies that are typically that will go high up early in the infection and then they linger. The VCA infection or antibodies for Epstein-Barr. Okay, I have to be careful because I will immediately, easily slip into shop talk and just blow everybody away with I don't want to do that. We want this show to be sensible, practical, and understandable. So let me say that there are tests that you can run that show that it's more likely to be chronic fatigue. And so that's why we end up running those kinds of tests.
So if a patient comes in and says, for the last 9 months, I haven't been able to get off my couch.
That won't make it likely, when you say 9 months, clearly this is not the flu, right?
Yeah, right. So that leads you to
Yeah.
believe, okay, this
This
is
would
a
be chronic
remnant
fatigue.
of...
So what about 2 weeks? Could it be the flu? I mean, could be something else? The answer is yeah. 2 weeks is a long time to be having this. In 2 weeks, I'd still be thinking you were either acute or suffering from some sort of acute.
Yeah.
And I'd start looking for more acute stuff. At 9 months, it shortens
Okay,
the
that
list.
was exaggeration. Okay, so, but like 3 months or a month.
Yeah.
A month.
I start looking for these kinds of things.
Okay.
More what drives this is kind of have you got your flu symptoms, Are they getting better? No.
No.
They're exactly the same. Are they even a little bit better? Yeah, well maybe someday I'm better and then someday I'm worse, and it mostly relates to how busy I was. If I'm super busy at work, now I'm wasted. If I tried to go on this hike with my friend, now I'm wasted. That's classic for chronic fatigue. That's what people complain about. As long as I don't move or I don't do anything, I'm pretty good. I've got to be real good friends with my couch, right? I don't want to get out of bed. On the weekends, I'm good for nothing. I want to go out. I can barely survive. That's what people will tell me over and over again. I used to have a life, and now I don't.
Right.
Can you help me get my life back? And the answer is, yeah, there's all kinds of stuff we can do.
Are there different bacterial infections within the gut that can impact and cause chronic fatigue?
Kinda. At that point, it's a matter of definitions. Okay, let me just say, yes. Except for if you want to be strict about the definition of chronic fatigue, no.
Okay.
Is that clear?
Yeah. Clear as mud.
Yeah, because you could get these low-grade infections. They screw up your immune system. They make you feel sick and flu-y, and then you never get better. I mean, that's chronic fatigue. Now, in this case, the example you give me is we found this low-grade infection in your digestive system, and so now we have a reason. Now it's no longer chronic fatigue. We found a reason, right?
Right. It's a different diagnosis.
It's a different diagnosis.
Not the chronic fatigue diagnosis. Okay. Semantics. So how would you go about treating a patient who...
That's an excellent question. Isn't that the trick?
Right? If they've been suffering for a month, for 2 months, for 9 months, then what do you do?
Okay, so let's say they have this super low-grade stealth infection. Well, let's treat the infection. Yeah, with what? Antibiotics? No, doesn't work.
Yeah.
Antivirals? No, it doesn't work.
Yeah.
That's the problem with this condition. Anything you would ever use doesn't work.
Right, because isn't that what they're treating the initial virus with in the first place in order for it to, clear their system, but then the remnants latch on, so...
Yeah, so treating viruses, let's talk about that, treating viruses. Antivirals are weak. They mostly don't work. If you do the research and there's a slight improvement of this, a percentage chance you'll get better, but none of them are surefire. None of them work every single time. In fact, the failure rate is really high with all of them. And here's why. Viruses are barely alive. In fact, they're not really alive. They're not living at all. They don't breathe. They don't eat. They don't poop. They don't do anything. They don't move other than randomly by being bumped by stuff and kind of floating around in the air on other stuff. They're all they are is they're little snippets of information. They're like a list of instructions that take a regular cell that makes regular cell stuff and converts it into a virus factory. That's what they do. They take over regular cells. Now, while they're in the cell, there's lots of action going on. The cell is turned into a virus factory. The protein-making parts, ribosomes, are busy working, putting amino acids together, having them fold and make a little capsule, and then storing them in little vacuoles ready for when the cell explodes. Boom, it all blows up, and now you went from one virus to 1,000 viruses because the cell just turned into a virus factory. That's when you have to kill the virus, is when it's in the cell. Now, this is tricky because our body doesn't like to kill our own cells.
No.
Given the choice.
Right.
Except for I'm going to have to kill that because that's not our own cell. That's a zombie cell now that's taken over and is becoming a virus factory, right? I know I'm mixing my metaphors slightly there, but you get the point.
Right.
So the immune system is pretty good at this, to be able to recognize when the cell starts to stink. It smells funny. This one's not doing what it's supposed to do. We're going to bring in the big guns over here. We're going to blow this thing up. And that's what the immune system does. So if you want to get rid of these infections, what you have to do is stimulate the immune system to do its job better. That's the trick.
So it's not so much about the antivirals and killing the virus.
No. No.
It's about stimulating the immune system.
Yes. Yes.
To then do its job and
yes,
kill.
Because we don't have any medications that work better than our immune system. Not by a long shot. Our immune system is much, much, much more effective at killing these infected cells.
What about the antivirals that we formulate in clinic with our herbs? Are those to stimulate the immune system?
Yes.
Or, okay.
That's exactly what they're there for.
Oh.
Now, every once in a while we get lucky, and there's some kind of little widget that has to come together to make the virus work. And so we come up with a widget breaker, and it comes into the cell metabolism and busts these things up. That's like with HIV. There's medications that literally break the manufacturing of HIV virus. It doesn't necessarily eradicate the virus from your body because it doesn't work that way, but it'll knock down the reproduction of it to the point where the body can keep up, or just knock it down enough to where there's not enough of it around to really do the widespread takeover of your body. So it's a little technical about this. Again, this is a half-hour show for a general audience.
Yeah.
Let me just keep to the point. The point is the most effective treatment for chronic fatigue syndrome is to actually stimulate your immune system to fight off the infection, the remaining lingering infection that's in your system. Let's talk about long COVID.
Yeah.
So how do you treat long COVID? What's the treatment of long COVID? But what you want to do is you want to do two things. You want to make your immune system more effective at eradicating the COVID from your body, number one. Secondly, you want to calm your immune system down so it quits ringing.
So stimulate and calm.
Yep.
Those are two
opposite to each other. And that is exactly what we're trying to do. This is not easy. This is not a thing that you want to do at home by, making chicken soup and putting,
Is there a
turmeric
protocol
in
to each? Do you do the stimulation process first and then the calming, or the calming and then the stimulation?
Depends.
Okay.
Where people are. If they're real hot, you want to do the calming first because they're miserable, because they ache in every fiber of their body. Those people you do not want to stimulate. You want to calm them down. And there's calming herbs and stuff we can do. Let me just quickly talk about what some of these things are. Turmeric, we know. Curcumin we use. Licorice root, glycyrrhiza is one we use all the time. Mushroom extracts, reishi, that's Ganoderma, we like to use the most. The cordyceps, I'm using more and more all the time. Those are particularly effective. There's more to that list. There's all kinds of stuff that we can use. Those are the big ones we use to calm
for
things
the calming,
down.
yes.
For the calming part. Oh, the other one I have to mention is adrenal stuff. We had a whole show on adrenal recently, and adrenal glands are responsible for regulating the immune system, for calming the immune system down. Now, I gave you the example, if you were having some kind of horrendous immune system reaction, you went to the emergency room, there's a real good chance they would put you on prednisone to shut it down. Now, of all the things in the world to use, why prednisone? The reason why is because prednisone mimics the body's natural adrenal hormones, cortisol specifically. And cortisol calms the immune system down, so does prednisone. Now, prednisone calms it down so much that it basically shuts it down, and prednisone is potentially dangerous because you get an infection that can get the best of you because you shut your immune system down. Now, you'll feel a lot better, but you won't necessarily be better. So we got to be careful about these anti-inflammatories. Inflammation is not the enemy. It's just that sometimes inflammation is overwhelming. You following what I'm saying?
I am, yes.
Yeah, let me hammer it home so you get it perfectly clear. Imagine, if you will, you live in a house, and the house has an infection.
Yeah.
Dry rot. You push on the floor and it's a little spongy right there, huh?
Soft,
There's something going on here. It's not right. So you get on the phone and you call a carpenter. You have him come over and fix your problem, right? And so he gets a pry bar and a saw and he starts pulling stuff off, and now part of the wall's off and there's dust in the air and it's all this good, and you're like, this is inflammation. This is your body healing, and it creates symptoms that make it hard to live there. But you need to get the dry rot, so you say, okay, you can keep doing it, and just let you tolerate that amount of inflammation. That's normal. Now let's say 30 carpenters show up, and they're all tearing the walls down everywhere, and everything is coming undone, and you can't live here anymore, and your house is getting ready to fall down. Yeah, that's COVID.
Mm-hmm.
So it wasn't the virus, it wasn't the dry rot that was killing the house, it was the immune system overreacting. So if you got an overreactive immune system, we got to calm this down in a way that doesn't fire all of the carpenters.
Sure. Right, okay.
I can solve this problem. Yell, everybody, out.
No, we don't want to do that.
Whoa, dry rot, still happening.
Yeah, we still need some repairs being made.
They tried that with COVID. They tried, let's give them on steroids. And it worked. The symptoms went down and people felt better, and then they started to die of the actual COVID taking over their body.
Mm-hmm.
So, yeah, back to the drawing board, right? Scratch that. Let's try something else.
Was that when they put patients on ventilators? Were they also putting steroids through the ventilators?
No, this is back in China when they were first trying to figure out how to manage it.
Okay.
They used steroids. Now, steroids are not one thing. There's some things that are mild steroids, and you could do a little bit just to knock it down a little bit, so we don't shut down the healing process, but we don't lose the patient. So again, good question. There's subtlety here, and that would be the whole show of how to subtly manage.
So then, how would you, after you calm the immune system, when would you stimulate, and how would you know when to stimulate? And what would you stimulate with?
Herbs.
Obviously.
Yeah, so we end up using, the reason why I use herbs because they work better. The thing about herbs that's interesting is herbs are not one thing.
Right.
Herbs are 100 things.
In one.
In one.
Right.
Because it's an organic collection of stuff.
A compound.
Some of these compounds are more active than other compounds, but they all work together in a way that's calm. So herbs have a reputation for being very safe. They're not always. I mean, there's some herbs that are not safe. They're poison. They have a name.
Yep.
Right? But there's lots and lots of herbs in the world that are safe. But they're not perfectly safe because they have weirdness in them. And so like anything else, you have to use your good judgment, use the kinds of things that get the effect that you want, and then check to make sure that is the effect you want. So what I'm looking for with these herbs is, let me give an example. Let's say a classic case of chronic fatigue. We run the Epstein-Barr viral load and the antibody load, and it turns out they're high. There's a lot of virus, a lot of antibody. People are aching, they feel horrible, they have headaches, the whole kit and caboodle. So what we want to do in this one is, just like we said before, is get a sense of how bad the symptoms are. If they're not overwhelmingly bad, then we want to stimulate the immune system to get the virus out. So we put people on an herbal concoction. And what that herbal concoction does is it stimulates the immune system. And we run that for 2 weeks or 4 weeks or 6 weeks, depending on what the situation is. And then we check the viral load again. And we check the antibodies again. And we see if it worked. Now, there's two ways we can tell. Number one is we say, how do you feel? Better or worse, mostly better. And then also, let's do the test to see what the numbers come up with. And if the numbers are going in the right direction, good. We just did it. It came out great, right? We managed to pull this thing off. So now the question is, what herbs do you use? And then I can't answer that exactly because it's different for everybody.
Right.
Now, let's use Epstein-Barr as an example. There's an herb called Bidens that works particularly well. There's an herb called Isatis that works particularly well. I like lomatium. I use that quite a bit. I use glycyrrhiza. We talked about that earlier as a kind of an immune system regulator. I throw it in because I don't want people to flare, and it keeps things keeping on the even. And also, glycyrrhiza is a decent antiviral of its own accord. People who have chronic viruses tend to get cleared on glycyrrhiza. Now, I wouldn't use Bidens alone. It's not good enough. I wouldn't use Isatis alone. It doesn't work.
Right.
I wouldn't use glycyrrhiza alone. No one ever gets better. I have to do a combination of these things. And because you put this stuff together.
Right. And
the
so
average number of ingredients in a formula for chronic fatigue is what?
7.
7?
I mean, there are some of our formulas that have 12 different elements.
And
to
it's
it,
not I'm
so.
trying to put more stuff in. I'm
No.
trying to keep the least amount of stuff in it possible.
But
it's just we have to have a
that
little
the
of this and a little of that, and the
combination
combination tends to work better. And how do I get the knowledge of how to do this? trial and error mostly.
Study.
So Stephen Bruner wrote a book. I got it right here. Herbal Antivirals.
Okay.
This is an excellent book. Very, very helpful. This saved me a lot of time and trouble having to pick through stuff. So that's a book I like to use. I mean, I'm sitting in front of the library. I might as well just pull them off.
Might as well.
I mean, I figure you guys listening at home, you're going to want to know a little bit, a little understanding. Now, let me just be clear about this, and you know this already. Don't do this at home alone. It's a bad idea. There's too many moving parts. There's too many things that could get broken. You absolutely have to find somebody who knows what they're doing and partner up with them.
Somebody to run the test, somebody to interpret the results, somebody who knows.
You need a professional.
Yeah. Whether you're going the herbal route, whether you're going the pharmaceutical route, you need somebody who has knowledge of those to best treat your case.
Yeah, except for pharmaceuticals don't work on this.
Yeah.
I mean, not that I know of, unless somebody's doing something that I'm unaware of.
Mm-hmm.
To my knowledge, pharmaceuticals can't treat chronic fatigue.
Wow.
They're ineffective.
Okay.
They do not do what we want. They don't break people out of it. So here's the thing about chronic fatigue. If you go to a regular doctor and you say, I think I have chronic fatigue, inwardly the regular doctor kind of groans a little and goes, oh, not another one of these people. And they want to put you on
antidepressant. Yeah. Prozac.
And say you should exercise more.
Yeah.
Gah. No. Bad idea. You should never go to those people. They're not going to be helpful at all. Whereas here, if somebody shows up with chronic fatigue, I go, oh boy.
Another mystery to solve.
Not just a mystery, another one that it's going to be easy to fix. Easy.
Yeah.
I mean,
you've been doing this a long time. You've seen it a lot.
You get enough success, and you just know you can fix it. Now, with all humility, I can't fix every single thing everybody ever came, but pretty dang close.
Yeah.
Pretty dang close. If it's what I'm telling you, and it's this chronic viral thing, routinely we fix it. Routinely.
Any closing thoughts in our last few minutes?
Yeah, adrenal is key. The adrenal glands are usually cattywampus, and that's one of the reasons why people got lingered. They got hung up on this infection to begin with, because their adrenal glands weren't working very well. They're overstressed, overworked, overwhelmed, and then when they got an infection, instead of just getting sick and getting better, they got sick and they stayed sick because the adrenal glands didn't regulate their immune system correctly. So that's almost always a key element in treating these cases. Another one is, and with this every show we ever did right on this subject, is if they don't sleep, no chance. Can't get them better.
Absolutely.
No chance. Can't get them better. They absolutely positively have to sleep. And that is probably 3/4 of these people don't sleep well. Even though they're all tired all the time, their sleep is all broken. They wake up in the middle of the night and they toss and they turn, they can't sleep. And so you absolutely positively have to address the sleep to get any of this other stuff to work. So don't get the impression that herbs are the cure for chronic fatigue. They're not. They're a piece. They're a valuable tool to use in certain situations, and they're super, super helpful. But unless the situation is set up correctly, that people have their adrenals are working well, their digestive system's working decently, that their sleep is intact and they're actually able to sleep at night. Without those, I can't get them better. Those have to be there. Okay?
Wonderful.
Good.
Amazing. Thank you, Dr. Luper, again.
All right.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.